Hello, my name is Tanya. I am going to be doing the IV placement and discontinuation skills video. I am in my uniform for Nightingale College. I'm wearing my ID badge. So we're going to go ahead and check the doctor's orders. The doctor has gone ahead and ordered a IV placement for the patient that's going to be going into surgery. So we are going to be doing an 18 gauge needle. We go ahead and make sure that you have the right patient and you have the right route. I'm gonna go ahead and gather all of our supplies, go on into the room, knock, 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 go into the room, close the door behind me for privacy, introduce myself to the patient. Hi, my name is Tanya. I'm gonna be your nurse today. Can you please verify your name and date of birth? Patient goes ahead and verifies the name and the date of birth. We go ahead and check it with the patient's ID band. It all correlates. I'm gonna go on and explain what we're gonna do with the patient. So we just wanted to let you know that the doctor went ahead and placed an order for an IV insertion. So we are gonna go ahead and start an IV line for you. Are you okay with that? So patient says it's fine. We got the patient's consent. And before I start before I start placing the IV, ask the patient if they have any questions. Do you have any questions for me? Beautiful scenario. Patient says no. It's okay for us to go ahead and start the IV placement. So we're gonna go ahead and wash our hands or use the hand sanitizer, do proper hand hygiene. And my area is already prepped. My items are all here on the table for me, so I'm gonna go ahead and don my gloves. All right, so we're gonna go ahead and open everything up in front of the patient so the patient knows that everything is new. Opening all of our things. I'm gonna toss what we don't need. Okay, so first what I'm gonna do is I'm gonna go ahead and grab this needle here, or the syringe with the normal saline. And we're gonna go ahead and attach it to this end here. We're gonna prime the tube, so make sure that this clamp is not closing the tube so that you can prime it. We're gonna remove this end here, and we're gonna make sure that the line, there you go. All right, we're gonna set that aside. Now we're gonna go ahead and apply our tourniquet on the patient. And we do want to apply the tourniquet at least 4 to 6 inches from the insertion site. So we go ahead and apply. Tourniquet nice and tight. Do it so that we have easy release. And we're gonna go ahead and check for the distal pulse. Okay, distal pulse is good. We're gonna go ahead and clean the area with our alcohol swab. So because we have a swab, we're going in circular motions from the closer area to the outer area. Make sure everything is nice and clean. I'm gonna throw that. Make sure that the area is dry before we do our IV insertion. Okay. Now we have the IV here. We have the IV tube here, or the IV catheter here. So we're gonna go ahead and, we saw the vein. We're gonna go ahead and hold it taut, or anchor down about 2 inches below the insertion site. And then we're gonna insert the needle at a 30 to a 45-degree angle. So we're holding, we're inserting. All right. Down the vein, we have some really good blood flash. So now I'm gonna flatten the needle and go in a little bit more. Keeping the needle stable, I'm going to push the catheter in. So we're advancing the catheter only at this point. Advancing the catheter. And the catheter is in. So we're gonna go ahead and press this little white button to retract the needle. All right, so the needle is in, catheter is in place. We're gonna go ahead and release the tourniquet. And we are going to clamp the tubing. And we're gonna place the tubing here. Holding the catheter. We're gonna unclamp it. And make sure that the solution goes in. Actually, first we're gonna make sure that we have some blood. So we're gonna retract it a little bit. And I see the blood. And now we're gonna go ahead and flush. So there's no infiltration. Everything looks good. Okay. So all needle has been, all the normal saline has been pushed into the patient's vein. Everything is good. So now we're gonna go ahead and disconnect. First, we're gonna clamp. I wanna make sure that nothing comes out. Now we're gonna disconnect the syringe, not the needle. I'm gonna go ahead and put the Tegaderm over the catheter. Making sure that all the edges are sealed. Okay, all the edges are nice and sealed. And then from there, we're gonna go ahead and put, we're gonna label it. So we're putting our initial, our catheter gauge, date and time, and the length. And we're gonna mark it too. So initials, gauge is 18, 6, 8, 26. All right, we're gonna go ahead and put that right up here. And then this tube, we're actually gonna put a little bit of tape. The clamp should have been down here. All right, and we're gonna put this tube either end of the arm and tape it down so it's out of the way. Okay, so there we have it. Now we leave the patient in a comfortable condition or position, if they prefer to be lying down or, you know, sitting up a little bit. I'm gonna go ahead and take off my gloves since I'm already done. I'm gonna wash my hands. And before I exit the room, I ask the patient if there's anything else I can do for them. I leave the call light close to them so that they can call if they need anything. They don't need anything. So everything is done. I go back to the desk and then document everything that I did, placement, which arm, gauge, how the site looks, how the patient tolerated the procedure. I'll document all of that. So then now we are going to be doing the discontinuation of the IV. So I'm going to go ahead and gather all my supplies again, make sure it is the right patient, and we are discontinuing the IV on the correct site. So I'm going to gather all my supplies with me, which is going to be a band, it's going to be gauze, alcohol swab, and gloves. I don't think we're going to use the alcohol swab, so gauze and the gloves. Okay, so I knock on the door, knock, knock, knock. I go in, close the door behind me for patient privacy, do my hand hygiene. I go ahead and introduce myself again. Hi, my name is Tanya. I'm going to be your nurse. Can I please verify your name and date of birth? Patient verifies name and date of birth. I check it against their wristband, and it matches. So I explain to the patient what I'm going to do. The doctor has gone ahead and placed an order for us to discontinue your IV since you're about to be going home. Is that okay with you? Patient says that's okay. So we go ahead and move forward with the discontinuation of the IV. So I have my items with me. I'll do hand hygiene one more time. Okay. Hand hygiene. All right, so we're gonna go ahead and discontinue the IV for you. Okay, so first I'm gonna go ahead and remove this tape here. Make sure I clamp this, make sure I clamp it so that we don't have anything coming out. And then we're just gonna go around the edges and remove the tegaderm. Around all the edges. Okay. So I'm going to go ahead and put a gauze, apply some pressure. I'm going to pull out the gauze and we apply pressure for 30 seconds. While we apply the pressure, we make sure that everything looks good, that the tubing is still intact, that there's no bends or cracks, that there's no broken off parts. So everything looks good with this tube. The catheter is intact. We also need tape. This goes into the sharps container. So 30 seconds have passed. We're gonna go ahead and switch the gauze. Put this one. Now we're gonna apply tape right across the area. All right. And okay, Miss So-and-so, we are done. Please let me know if you have any questions or concerns. The call light is right here next to you. If you need anything, please just let me know. So I go ahead and take off my gloves, throw away all the things that we don't need anymore, perform some hand hygiene, exit the room, go ahead and document the discontinuation, document how the site looked, if there was any infiltration, document that the tube or the catheter was intact. If it wasn't, document what wasn't. So just doing all the proper documentation that is needed once we discontinue the IV. And that is it for my IV skills video. Thank you.